A new report from the Federal Trade Commission claims organizations known as pharmacy benefit managers, or PBMs, made billions by raising the prices of specialty drugs used to treat cancer, HIV, and other conditions. PBMs, the so-called middlemen in the pharmaceutical industry, only exist in the U.S. negotiating drug prices.
They mainly work on behalf of insurers, so their direct clients are health insurance companies and plans.
The report focused on the PBM's Caremark RX, owned by CVS Health, Express Scripts, owned by Cigna, and Optum RX, owned by United Healthcare. The FTC claims between 2017 and 2022, those companies generated $7.3 billion in revenue by marking up dozens of drugs, some by more than 1,000%. City Attorney Zach Klein says the scheme has cost the city and taxpayers at least $26 million in the past 3.5 years alone. Now he says it's about holding these companies accountable.
And this is an instance when you see what these PBMs are doing, they're not fair. They're paying artificially high prices. PBMs are raking taxpayers over the coals. It's happening at the state level, like it's been federally investigated. It's happening everywhere. And we're doing our part in the city of Columbus, especially as it relates to insulin, to go after them to recoup the money that's owed to the taxpayers of the city of Columbus.
According to the city's filing, even though the price to manufacture insulin and diabetes-related products has been decreasing, the costs of the drugs themselves have been increasing exponentially.
It's just for greed. I think at the end of the day, when you look at the cost of producing insulin is going down, but the cost of providing insulin is going up, these PBMs have been known for just wanting to be greedy. They just want to make money.
The Pharmaceutical Care Management Association, which represents PBMs, calls the FTC report baseless and without substantiating evidence. Looking to the future, critics question whether PBMs should be allowed to make a profit from their negotiations.
A pharmacy benefit manager in the United States gets to get a higher revenue if they are negotiating and paying for a higher cost drug, and they get to make less money if the drugs that they're negotiating are cheaper. So that's a big problem because it indirectly incentivizes prices to remain as high as possible.